Welcome to Health Builds Life. Today we uncover 7 deadly nighttime mistakes that drastically increase your risk of a stroke. Many people believe sleep is completely safe, but the hours between midnight and 6 in the morning are actually dangerous. During these quiet hours, hidden habits can trigger severe cardiovascular events, turning your peaceful rest into a potential medical emergency. We will count down these fatal errors from the least severe to the absolute most dangerous habit you must avoid. Understanding these risks could literally save your life or protect a loved one from an unexpected and devastating health crisis. Medical experts have analyzed thousands of patient records to identify exactly why strokes happen so frequently during the early morning. The human body undergoes complex changes while resting, making our blood vessels highly vulnerable to sudden spikes in internal pressure. By changing just a few evening routines, you can build an invisible shield around your brain and strengthen your heart. Let us dive right into mistake number 7, which involves how you position your body while resting in your bed. Sleeping completely flat without elevating your head can significantly reduce essential blood flow to the brain for older adult individuals. If you are over 60 years old, lying totally flat makes it harder for oxygen to reach your brain cells. Gravity plays a crucial role in how our circulatory system distributes vital nutrients and oxygen throughout our entire nervous system. When your head rests at the exact same level as your heart, blood can pool and create unwanted intracranial pressure. This subtle pressure buildup over 8 hours can slowly damage microscopic vessels, increasing the likelihood of a dangerous morning rupture. You should always use a supportive pillow to keep your head slightly elevated and maintain optimal circulation throughout the night. A simple elevation of just a few inches is often enough to protect your cognitive function and prevent serious damage. Moving on to mistake number 6. We examine a very common issue that many people ignore before going to sleep. Allowing your body to become dehydrated right before bed is incredibly risky because it directly affects your overall blood consistency. When you lack adequate water, your blood becomes thicker and much more difficult for your heart to pump properly overnight. This dangerous thickness increases the chance of clot formation, which could easily travel to your brain and cause a stroke. Throughout the night, we lose a significant amount of moisture simply by breathing and sweating under our heavy, warm blankets. If you start your sleep cycle already depleted of fluids, your blood viscosity reaches critically high levels by early morning. This is exactly why so many ischemic strokes occur right before dawn, when dehydration peaks and circulation is extremely sluggish. Drinking a small glass of warm water before resting can keep your circulation smooth and protect your delicate neural pathways. Do not drink too much, or you will ruin your rest by waking up constantly to use the bathroom facilities. Now we arrive at mistake number 5, a critical error related to how you manage your daily blood pressure medications. Taking these powerful pills too close to bedtime might seem logical, but it can actually trigger a severe negative reaction. This habit often causes nocturnal hypotension, and meaning your blood pressure drops dangerously low while you are in a deep sleep. When pressure falls too much, your brain becomes starved of oxygen, creating a perfect environment for a silent ischemic stroke. Your body naturally lowers its blood pressure during sleep to rest, so adding medication at this exact time is overkill. The combined effect forces your heart to struggle just to push a minimal amount of blood up into your brain. Many patients wake up feeling dizzy or confused, completely unaware that their brain was suffocating for several hours during sleep. Always consult your doctor about the best time to take your medication to maintain stable pressure levels throughout the night. Mistake number 4 focuses on the physical environment of your bedroom, specifically the ambient temperature you choose for your rest. Sleeping in a room that is warmer than 22 degrees Celsius might feel cozy, but harms your delicate heart. High room temperatures prevent your core body heat from dropping naturally, which is a vital process for healthy restorative sleep. This excess heat directly increases inflammatory markers inside your cardiovascular system, putting extreme stress on your major veins and arteries. When you are too hot, your heart has to beat faster to help cool your body down through your skin. This unnecessary nighttime labor exhausts your cardiac muscles and raises your blood pressure exactly when it should be fully resting. Furthermore, excessive sweating in a hot room rapidly accelerates dehydration, compounding the dangerous blood thickening effect we discussed earlier today. Keeping your bedroom cool and well ventilated is a simple yet powerful way to defend your brain against sudden strokes. Now we face mistake number 3, and a widely ignored condition that silently damages thousands of lives every single night globally. Leaving sleep apnea untreated is a catastrophic error that repeatedly forces your body to stop breathing while you are unconscious. Each time you stop breathing, your blood oxygen levels plummet rapidly, sending massive shock waves of panic throughout your nervous system. This terrifying cycle damages the fragile lining of your cerebral blood vessels and increases your stroke risk by 400%. Your brain detects the lack of oxygen and triggers an emergency survival response, spiking your heart rate and blood pressure. Imagine your cardiovascular system acting like an engine being violently revved up and shut down hundreds of times every night. Over time, this mechanical trauma creates micro-tears in your arteries, where dangerous cholesterol plaques and fatal blood clots form. If you snore loudly or wake up gasping for air, you must seek immediate medical evaluation to protect your brain. Using a prescribed breathing machine can completely eliminate this risk and provide you with the deepest, most healing sleep possible. Mistake number 2 involves your mental state, specifically allowing stress and negative thoughts to consume your mind right before bed. Worrying in the dark triggers your adrenal glands to release massive amounts of cortisol and adrenaline into your bloodstream immediately. These stress hormones are designed for survival, but at night, they aggressively thicken your blood and elevate your resting heart rate. This toxic chemical combination makes it incredibly easy for dangerous blood clots to form and block vital arteries while sleeping. Chronic anxiety literally rewires your nervous system to remain in a constant state of high alert, destroying your vascular health. When cortisol remains high during sleep, it prevents your body from performing crucial cellular repairs inside your damaged blood vessels. You must create a mental boundary between your daily problems and your sleep sanctuary to guarantee your long-term survival. Practicing deep breathing or listening to calming music can effectively neutralize these hormones and secure a safe passage into sleep. Finally, we reach mistake number 1, the absolute most dangerous nighttime habit that dramatically multiplies your risk of sudden stroke. Eating a large meal or consuming heavy snacks right before you attempt to sleep is a deadly choice for everyone. When you eat late, an enormous volume of blood is forcefully redirected toward your digestive system to process the food. This massive internal shift forces your heart to work overtime, significantly raising your blood pressure when it should be resting. The extreme strain can easily trigger atrial fibrillation, an irregular heartbeat that increases stroke probability by a terrifying 500%. Your digestive organs demand so much energy that your brain is left vulnerable, deprived of the steady circulation it requires. Digesting heavy proteins and fats creates a massive metabolic surge, keeping your core temperature high and disrupting your healing cycles. Furthermore, lying down on a full stomach causes severe acid reflux, which creates massive inflammation near your heart and lungs. This inflammation sends dangerous signals through your vagus nerve, potentially causing dangerous cardiac arrhythmias during the darkest hours of night. You must absolutely stop consuming any solid foods at least 3 full hours before you plan to close your eyes. This vital fasting window gives your stomach enough time to empty, allowing your cardiovascular system to relax and recover safely. If you feel incredibly hungry, and a tiny piece of fruit is acceptable, but never consume a full, heavy meal late. Your nighttime choices dictate your morning survival, so treat your bedtime routine with the ultimate respect and serious medical attention. By eliminating these 7 deadly mistakes, you empower your body to heal naturally and wake up feeling refreshed and alive. Take control of your evening habits today and share this vital knowledge with anyone you deeply care about right now. Thank you for watching Health Builds Life, where we provide the science and strategies to protect your most valuable asset. Stay healthy, sleep safely, and remember that Health Builds Life will always be here to guide your wellness journey forward.